This video explores 10 often overlooked signs and symptoms that could potentially indicate breast cancer. It aims to provide viewers with advanced knowledge beyond the commonly discussed lumps, empowering them to be more vigilant about their breast health. This information is crucial for early detection, which significantly improves treatment outcomes. 1-1. Persistent back pain. Many people experience back pain, often attributing it to muscle strain or poor posture. However, persistent back pain, especially in the upper back or between the shoulder blades, can sometimes be a less obvious sign of breast cancer. This occurs when a tumor metastasizes or spreads to the bones in the spine. Approximately 10% of women with breast cancer will develop bone metastasis at some point. This pain is often described as a deep ache that doesn't improve with typical remedies like rest or over-the-counter pain relievers. It might be accompanied by other symptoms like weakness or numbness in the legs if the spinal cord is affected. It's important to note that most back pain is not cancer-related, but any new, persistent back pain, particularly if you have other risk factors for breast cancer, warrants a discussion with your doctor. Early detection of bone metastasis can significantly impact treatment options and quality of life. Don't dismiss new or worsening back pain, especially if it feels different from your usual aches and pains. 2. Changes in nipple appearance. While many are aware of nipple discharge as a potential sign of breast cancer, subtle changes in the nipple's appearance can also be significant. This includes a nipple that suddenly becomes inverted, turns inward, when it wasn't before. Approximately 5 to 10% of breast cancers are inflammatory breast cancer, which can cause skin changes around the nipple, leading to retraction or flattening. Other changes to watch out for include scaling, crusting, or thickening of the skin on or around the nipple. These changes can sometimes be mistaken for eczema or another skin condition, leading to delays in diagnosis. If you notice any new changes in your nipple's shape, size, or texture, it's crucial to have it evaluated by a medical professional. Remember that normal nipples come in a variety of shapes and sizes, so the key is to be aware of any new or noticeable alterations. 3. Swelling in one breast. It's common for women to experience some fluctuations in breast size due to hormonal changes during their menstrual cycle. However, a noticeable and persistent swelling in only one breast without a clear cause like infection or injury can be a subtle indicator of breast cancer. This swelling may not always be accompanied by a palpable lump. In some cases, it can be a sign of inflammatory breast cancer, a less common but aggressive form of the disease. Inflammatory breast cancer often presents with redness, warmth, and a thickened, pitted texture of the breast skin, resembling an orange peel. Around 1 to 5% of all breast cancers are inflammatory. If you observe a persistent swelling or enlargement of one breast that doesn't seem related to your menstrual cycle, it's important to seek medical attention for proper evaluation. 4. Unexplained fatigue. While fatigue is a common symptom with many potential causes, persistent and unexplained fatigue that doesn't improve with rest can sometimes be associated with cancer, including breast cancer. This isn't the typical tiredness you might feel after a long day. It's often described as a profound exhaustion that interferes with daily activities. The exact mechanisms linking cancer and fatigue are complex and not fully understood, but it's believed to involve factors like the body's inflammatory response to cancer cells and the energy demands of tumor growth. Studies suggest that up to 90% of cancer patients experience fatigue during some stage of their illness. If you're experiencing persistent, debilitating fatigue that has no apparent cause, it's important to discuss it with your doctor, especially if you have other risk factors for breast cancer or are noticing other unusual symptoms. Into changes in breast skin texture. Beyond the orange peel appearance associated with inflammatory breast cancer, other subtle changes in breast skin texture can be warning signs. This can include areas of thickening or hardening that don't feel like a distinct lump. The skin might also appear dimpled or puckered in certain areas. These changes can be caused by cancer cells affecting the underlying connective tissue of the breast. It's estimated that skin changes are a presenting symptom in around 10% of breast cancer cases. Make it a habit to not only feel for lumps, but also to visually inspect your breasts for any changes in the skin's surface. If you notice any new areas of thickening, dimpling, or puckering, even if you don't feel a lump, it's important to get it checked by a healthcare professional. 6. Pain or discomfort in the breast. While a painless lump is often cited as a classic sign of breast cancer, it's important to know that some breast cancers can present with pain or discomfort. This pain might be localized to a specific area or feel more diffuse throughout the breast. It could be a persistent ache, a burning sensation, or even a sharp, stabbing pain. It's crucial to remember that most breast pain is not due to cancer and is often related to hormonal fluctuations or benign breast conditions. However, new-onset breast pain that is persistent doesn't seem to be related to your menstrual cycle and is not associated with an injury should be evaluated by a doctor. Studies indicate that around 10 to 15% of women with breast cancer report pain as a symptom. Don't dismiss new or unusual breast pain, especially if it's accompanied by other changes. 7. Swollen lymph nodes. Under the arm or near the collarbone. Lymph nodes are small glands that are part of the immune system. They filter waste and fight infection. Swollen lymph nodes can be a sign that the body is fighting an infection, but they can also indicate the spread of cancer cells. Breast cancer can sometimes spread to the lymph nodes under the arm, axillary lymph nodes, or near the collarbone. These swollen lymph nodes might feel like small, firm lumps under the skin and can sometimes be tender to the touch. Approximately 20 to 30% of women diagnosed with invasive breast cancer will have evidence of lymph node involvement. If you notice any new or persistent swelling or lumps in your armpit or near your collarbone, it's important to have them examined by a medical professional. 8. A change in breast size or shape. While slight variations in breast size are normal, a noticeable and persistent change in the size or shape of one breast compared to the other can be a subtle sign of breast cancer. This change might be gradual and not immediately obvious. You might notice that one breast looks or feels different in terms of its overall shape or how it sits. This can be due to the growth of a tumor altering the breast tissue. It's important to be familiar with the normal size and shape of your breasts so you can recognize any new changes. If you observe a persistent and unexplained difference in the size or shape of your breasts, even if you don't feel a lump, it warrants a medical evaluation. 9. Unusual discharge from the nipple. While nipple discharge is a more commonly known symptom, it's important to reiterate that any new and unusual discharge should be investigated. This includes discharge that is bloody, clear, or any color other than milky if you are not breastfeeding. The discharge might occur spontaneously without squeezing the nipple and might only affect one breast. While many benign conditions can cause nipple discharge, certain types of discharge can be associated with breast cancer. Studies suggest that nipple discharge is a presenting symptom in around 5 to 10% of breast cancer cases. If you experience any new, spontaneous, or bloody nipple discharge, it's crucial to see your doctor for diagnosis and appropriate management. A persistent itchy rash on the breast. A persistent itchy rash on the breast, particularly around the nipple area, can sometimes be a sign of Paget's disease of the breast, a rare type of breast cancer that affects the skin of the nipple and areola. This rash might look like eczema or another skin condition with redness, scaling, and itching. It might come and go, but will eventually persist and worsen if left untreated. Paget's disease accounts for about 1 to 4% of all breast cancers. If you develop a persistent itchy rash on your breast that doesn't respond to typical treatments for skin conditions, it's essential to have it evaluated by a dermatologist or your primary care physician to rule out more serious underlying causes. Recognizing these subtle changes, in addition to the well-known symptom of a breast lump, can empower you to be more proactive about your breast health. Remember that most of these symptoms can also be caused by benign conditions, but it's always best to err on the side of caution and consult with your doctor if you experience any persistent or concerning changes. You might also want to watch this video on understanding breast cancer risk factors. Please subscribe to this channel if you found this video helpful. Thank you for watching.